And I have to say, this portion of the meeting is truly one of the highlights for me. It's wonderful being with all of you. It's wonderful getting to hear and talk about lots of this wonderful work. But truly, one of the highlights is getting to give this award to such a phenomenal social insurance warrior, someone who has truly devoted his entire life to workers' compensation. You were just hearing a little bit from Tyler about how the Academy wouldn't be doing any work on workers' compensation if not for this individual. Countless workers' lives have been touched by his work, even if they don't know his name, and that's John Burton. Many of you know him. Many of you are with us today, either in the room or online, because he has touched your lives as well. And so John was unable to join us in person, but he is joining us virtually. And so I believe we have him with us online. Can Tom confirm? Is that right? Excellent. So, John, you are with us here in the room in presence, and it is our absolute pleasure and honor to get to celebrate you in this way. And so now I'm going to get out of the way and let a few people who know him really well talk about him. And I think we're going to start with Virginia Reno, and we have a few folks who want to say nice things about you, John.
Well, hello, John, and everyone else who's here. I am delighted to have this chance to say just a few words about John. There is so much to say about his career. I have just a piece. He was the prime mover to help the Academy produce quality national data on workers' compensation, and that effort continues today. Until the early 1990s, the Social Security Administration was the only source of data on workers' comp, benefits paid to workers and costs incurred by employers, and they put out a report every year. But with the retire of the employee who was left doing that in the 1990s, and SSA's inability to hire anyone else to do it, it looked like these data would end. Well, John Burton, who's one of our nation's scholars on workers' comp, made sure that did not happen. He engaged experts representing workers, employers, and workers' compensation providers to come together to advise on what to do about this. He also helped gain support from the Robert Wood Johnson Foundation to launch a new project for the Academy to take on the job of continuing the workers' compensation data. That began in 1996. That series that he started continues today with the latest report issued in November of last year. John Burton has been a mover, a shaker, and a sustainer in the workers' comp field, and he's brought the Academy into the midst of it.
Thank you so much, Dana. You can pick up it.
Great. Thank you, and great to follow Virginia. John Burton, hi out there. John's been in the forefront of research into and advocacy for improving workers' compensation benefits for more than 60 years. John's PhD, which he completed in 1965, was on interstate differences in the costs of workers' compensation. We are very fortunate that in 1971, he was chosen by the Nixon White House to serve as chair of the National Commission on State Workers' Compensation Laws, which was launched by the passage of the Occupational Safety and Health Act of 1970. And that's how I really got to know John. I ran OSHA under President Obama. People often fail to link OSHA and workers' comp, and there's actually a provision in the OSHA law that says OSHA can't mess with state workers' compensation systems. But it was well recognized that Congress at that time reasoned that we needed OSHA because of the failure of the workers' compensation system, the provisions like experience rating, which theoretically encouraged employers to prevent workplace injuries and illnesses, that had failed. At the same time, Congress recognized that workers were not being well served by those state systems, and they enacted the commission to evaluate the adequacy, efficacy, and equity of state workers' compensation systems. So under John's leadership, that commission did remarkable work, setting the benchmarks against which all state workers' compensation systems are measured, and that really continues to this day. The Commission's work led directly to improvements in many state workers' compensation programs, more generous benefits, expanded coverage. Many thousands of injured workers and their families have had better lives as a result of the Commission's work, and we can thank John for that. Unfortunately, the Commission's impact lessened over the years, especially as the U.S. Department of Labor decreased its already meager focus on workers' comp. The state-based workers' compensation systems remain the only part of the social safety net without meaningful federal oversight, and we could see the impact of that. But after that commission was launched, and for the next 50 years or so, John continued to research and teach about workers' comp. Most importantly, he illuminated many of the weaknesses and areas in which the system did not provide adequate benefits. His writings, especially with Emily Spieler, who you're going to hear from shortly, have provided the most comprehensive and insightful analyses of what has happened to the comp system over these decades. John has always been generous with his time and energy. During the years I ran OSHA, it was clear to me that the failure of the workers' comp carriers to push their policyholders to improve protections led to more worker injuries and more deaths. And the race to the bottom of state workers' comp systems has resulted in continually reduced benefits for injured workers and their families. But John could always see the big picture, and in one of his later studies, he demonstrated that when comp benefits declined and eligibility rules were tightened in the 1990s, SSDI applications increased. He recognized that what he called the spillover effect from workers' compensation to SSDI both undermined the incentives to workplace safety and aggravated the financial status of the Social Security system. It's clear all of us committed to the well-functioning system of social insurance owe a huge debt of gratitude to John for his tireless commitment and extraordinary efforts to make the workers' compensation system provide the benefits to which injured workers are entitled. So, John, thank you so much.
Thank you so much, David. So I think we've got Emily in cyberspace. Is Emily Spieler with us?
Really appreciate the opportunity to participate virtually and to be able to talk a bit about John. Although much of what I'm going to say is probably repetitive, and since I have a lot to say, I'm going to read something. Okay, so I believe that John has had more impact on a single social insurance program than anyone else in the nation on any other program. For many years, workers' comp has sat a bit at the sidelines in national conversation. It's not surprising, as has been already pointed out, it's a state-based program largely, without any federal standards or federal financing. And that makes it actually really hard to study and really hard to influence. Workers' comp, though, is an essential part of the safety net for American workers, just like UI and SSDI and the other programs we've been talking about. And as you've already heard, John has been leading the research and the debates about this program since the 1960s. David talked about the National Commission, and really the National Commission launched John's national career. It was his leadership that managed to take a diverse, bipartisan group of people with vastly different views and build a consensus that not only acknowledged the terrible inadequacy of state compensation programs, but actually made consensus recommendations to improve both the adequacy and fairness of the systems. It's hard to imagine this today, I think, but not a single minority or dissent report was filed on that commission report. And as you've heard, that report had long-reaching and remarkable effect, leading states fearing federal intervention, I think, to improve the levels of weekly benefits and other aspects of the system. And John has continued since then to be the leading researcher and advocate for the basic principles of fairness and adequacy. This led him later to continue his investigations and to lead conversations about other issues affecting access to adequate benefits, including rules that tightened eligibility standards and led to, as David said, increasing spillover into other systems, He's never slowed in his commitment to the goals of adequacy and fairness. He's never slowed in his willingness to play organizing and leadership roles, and he has continued to participate in and encourage new areas of research. Along the way, he has, as David also said, been incredibly generous with his time, and he's led conversations and he's mentored many of us. For me personally, he read my early work, brought me into national conversations, co-authored articles and chapters, and we engaged in lively conversations about all things workers' compensation. While this award is for his lifelong and dedicated research and public advocacy, it also gives me the opportunity to thank him publicly for his mentorship of me. I regard him as a role model for those of us who care about fairness and adequacy in all social programs, and that's a role model for all of us who are engaged in the Academy's mission, as Rebecca described a little earlier today. Thank you.
So much, Emily. And then last, do we have one more speaker with us? Do we have less?
First of all, John, I'm glad to hear the weather is so nice in New Jersey. I want to start by saying that John will shortly celebrate his 50th birthday. And from everything he's accomplished, I would think he was at least 120. After he chaired the National Commission on State Workmen's Compensation Laws, John worked to leverage the report. And as a result of John's work, I wanted to give you a few specific examples of how state laws changed between 1972 and 1980. The Commission made 19 essential recommendations to improve workers' comp. And in 1972, the year of the Commission report, Alabama complied with only 2 of those recommendations. By 1980, it had complied with 9. During that same period, California went from complying with 7 to 12, Illinois from 4 to 14, and Nevada from 3 to 14. This was a really monumental accomplishment. Most of us at the intersection of research and policy consider ourselves lucky if we have 1 or 2 much smaller impacts on our working lives. John published well over 100 newsletters between 1980 and 2015. They were designed to gap between research data and policy in the workers' comp area. He's not only a model of the engaged researcher, he's been a fabulous source of support and mentoring many other researchers in this area of social insurance. He's worked above and under the radar. For example, under the radar, he organized the Workers' Compensation Research Group, bringing together academic and state workers' comp researchers to discuss their work, to get feedback, and to get mutual support. Without fanfare, this group met annually under Jobs leadership for almost 15 years. I love the meetings, their collaborative, mutually respectful environment, an environment that reflected the group's leader. It helped us all support each other's work, and I really appreciated it. Thank you, John. John and Berkowitz were pioneers in addressing the adequacy of workers' comp benefits, publishing a book on the topic in 1987. On a personal note, this book inspired me to plunge into this line of research, and I've always been grateful for their leading the way. Also, on a personal note, John has always had kind words for me and for my work, words that I have greatly appreciated. John has always cared that workers' compensation provide adequate benefits for workers who became injured or ill on the job. That caring was reflected in the 1972 report and in the rest of John's life as a person who successfully integrated research and advocacy. In these times when the social safety net is under constant threat, we need more people like John to stand up for what is right. Thank you, John.
Thank you so much, Les. And so, John, I hope you've been hearing all these nice things people have had to say about you. It's such an honor and a privilege to get to honor and celebrate you in this way. And I think it's a long time coming. Clearly, you've touched a lot of people's lives. So yeah, if you're ready for it, we're going to go ahead and present you with the award. We're going to do that in the room. And so, David, would you be open to accepting the award for him?
Sure. It's an honor for me.
All right, so Paul, I'm going to ask you to join me in this. And then we'll go ahead and read the inscription. So, John, so you can see it. It says, honoring John Burton for a lifetime of leadership on workers' compensation, National Academy of Social Insurance, January 2025. So it's an honor to present this award to David on your behalf.
We will make sure you get this. It's an honor for me just to hold this, to be in John's shadow. I mean, he really is that sort of leader. He's a giant among researchers and social insurance advocates. So thank you, John.
Oh, can we help with John's sound? John,
Can
go
you
ahead.
hear me?
Now we can hear you. Perfect.
Okay, great. Okay, I just want to express my appreciation, and obviously there's a little bit of mix-up here on the audio, and it's interesting. I'm looking at a screen that looks like I'm in Hawaii, and in the background, I don't know how it's doing that. Actually, I'm in beautiful New Jersey with snow outside my window, not breaking of waves. So, anyways, this is a wonderful occasion for me. I've been a member of the National Academy. I was one of the charter members for workers' compensation, so I go back a long way, and it's one of my honors to be a member and to certainly receive this award. Thank you so very much.